I guess many people have alluded already today to this issue, and I guess, you know, if I thought there was one thing that's come out of looking at the evidence around the impact of benefits or worklessness, sorry, I'll go to the worklessness component, has been the wider impact other than on the person concerned. I had the pleasure of, or the good fortune of meeting Dame Carol Black, who is the Chief Medical Advisor to the British, I think they call it the Department of Work and Pensions, who released a paper last year called Working for a Healthier Tomorrow, which Kevin's going to allude to later. And I asked her about the issue about how do we persuade or influence doctors, because they do a lot of the certifying around disability benefits, around the impact of worklessness. And she said, well, you really got to just point out the impact on the families, because if it's bad for the person, it's worse for the families. And there's been a number of allusions to that already during the course of, well, just about everybody's talk today. Probably David Cable's referred to that. There's evidence of general poor health, and there's certainly evidence of early death.
Could you just describe what you mean by worklessness? I mean, it is an important, even if we don't agree with the definition, it would be good to know what the definition is.
Well, I guess joblessness maybe describes it better. I think there was an effort to try and move away from, it's not actually the receiving a benefit, it's the being out of a job that provides you with a sense of independence, of the dignity that was referred to earlier, of many of our value structures, at least, well, in most societies, orientate around the capacity to support both yourself and your family. Those sorts of things require generally paid work. So it is usually work or a job, and I guess the thing that's quite important is the evidence does suggest it has to be, they use the word either decent work, I've used in the next slide the word suitable, or further on, suitable work. There was the issue about just any job may not do it. I mean, there are jobs that actually are probably demoralising rather than enabling, perhaps might be the way to put it. And in fact, interestingly, irrespective of the income, this is actually can be income independent. Someone with a job that gets the same income as somebody on a benefit will in fact have better health outcomes. So if you control for benefit, and control for income in that situation, although the determinants of health are obviously important, and will come up shortly.
And differ by gender.
Sorry?
And differ by gender.
I haven't seen a lot of evidence that's necessarily the case, but of course it may be, depending on, again, that's a societal issue. Different expectations and values vary in different cultural contexts, so it will be different in different environments. So you're right in that sense. This is quite an important statement, especially given I rather like the reference to the oil rig. I wasn't quite sure if it applied to the Florida recent incident, but this comment came, of course, after there was an oil rig fire in the North Sea. But Professor Gordon Waddell and Kim Burton produced a paper on the health benefits of work in 2007, and this was just a statement from them. You don't need, well, hopefully you don't need me to read it, but I can read it in case it's a problem. I tried to make the font big enough. I work with someone who is particularly critical of small font, and I couldn't help but think some of the slides we saw today seemed to be getting smaller every time they got up, and I wasn't sure if I was moving further back or whether it was just a test of my vision, really. See whether I've been abusing myself for too long or something. Long-term worklessness, one of the greatest health risks to health in our society. It's more dangerous than the most dangerous jobs in construction, and after all in New Zealand that's a particularly dangerous environment, or working on a North Sea oil rig. And too often we fail to, and this is a doctor talking, probably aiming this at other doctors by the way, we fail to protect our patients, hence with patients from long-term worklessness sometimes we actually push them into it. One of the themes that we will have or I will have, is that there is a wider, this is not an individual decision, there is almost a societal move and support. And many of my colleagues, in fact, and I don't exclude myself from that, so, have participated in the contributing to worklessness. And I suppose it shows some of the change of the effective evidence. And one of the reasons we're trying to show some evidence is, you know, I was graduated long enough ago. Actually, I started before ACC was introduced, so that shows how long ago it was. But at that stage, the common treatment for serious back problems was bed rest. In fact, they used to make huge plaster casts for people to be supported in, and they'd be like that for 3 months. Nowadays, if you kept anybody still for more than about 3 hours, Kevin no doubt would have you out for, you know, for Milton's treatment, basically. Activity is very well established as a key part of recovery for most back issues. So evidence has moved along and does cause us to change our approach. At this stage, I would regard my profession as currently a little bit behind the 8 ball. So I've put worklessness not as a definition up here, but just to indicate how quickly it sets in. Now, these figures here come from Australia, but I know Kevin could show you figures that show exactly the same thing happens here. Basically, if you've been out of work for 3 months, you've less than 50% chance of getting back to your job, or possibly any job. This happens extraordinarily quickly. And if any of you think that can't possibly be true, just imagine the last time you had an extended period of time away from your job. Now, I'm not talking about 2 or 3 weeks. I'm talking about a couple of months or 3 months. How terribly difficult it was to get back into work. We get deconditioned. We're used to getting up. I mean, it's the worst thing about the weekend. I still wake up at 6 o'clock in the morning. I might say this, you know, the weekend when it was pouring with rain, it was a luxury to lie there and think I didn't have to get up. And then, of course, on Tuesday, I forgot. That was all.
Is that because depression would set in after a certain period of time?
It's probably a variety of things. Whether depression sets in necessarily that quickly, it would be hard to know. I'm sure that's a compounding factor. I'll just use the global expression of a sort of fall-off in, I'll call it work fitness, I suppose, but it's not work fitness like you can run up the stairs. I don't mean that sort of work fitness. I just mean you kind of, I mean, you can lose your confidence. You may have applied for jobs. I mean, there's all sorts of factors. I mean, it is multifactorial, as was indicated.
That's in direct conflict to information earlier in the day about paid maternity leave. Substantive paid maternity leave up to, what was it, 6 months, supports a woman's attachment to her employment.
Yes, one could argue if you're on paid maternity leave, you haven't actually lost your job.
Well, that's what I'm asking you. What are you talking about?
I'm talking about losing your job. Then you're out of work.
No.
Yes. Sorry,
No,
that's what I mean.
No,
So
well,
I'm actually going to move on, as I'll never get finished.
That's my concern. What is it are you talking about? Are you talking about unemployment? Are you talking about sickness? Or are you talking about childcare?
Those are 3 completely different things. So.
And they are all explicitly the subject of these 2 days. So which component of those are you talking about?
All right. I'm currently talking about those situations where you do not have a job. If you're on maternity leave, you do have a job to go back to. That's why you had paid maternity leave. You just described it. Thank you.